You're listening to a health podcast, which means you probably care about health and you enjoy podcasts. I'm Dan Kendall, the founder of Health Podcast Network, and I want to invite you to join me and thousands of healthcare professionals and leaders at the annual health event taking place in Las Vegas, October 20th to 23rd. When you're there, I'd love to meet you at our exclusive reception on Monday, October 21st. In fact, the host of the show you're about to listen to plans to be there too. Reserve your spot. Visit healthpodcastnetwork.com/health. That's healthpodcastnetwork.com/HLTH and save $250 with our special discount code. Again, that's healthpodcastnetwork.com/HLTH. I look forward to seeing you there.
As a doctor, my medical oath was to do no harm. But I was unknowingly compromising my patients' health by dismissing their cultural identities daily in my clinical practice.
My primary care provider told me to cut down on rice, and I started laughing in his face so hard. And I was like, do you understand? There is a rice cooker on in my house 24 hours a day.
I discovered that truly helping my patients meant understanding and respecting their cultural foods, beliefs, and practices, not just giving them canned advice on what I thought was scientifically correct or was taught to me in medical school. I'm Dr. Raj Sundar, and this is Healthcare for Humans, the show dedicated to educating you on how to care for culturally diverse communities so you can be a better healer and achieve better patient outcomes. Each episode dives deep into stories and topics that challenge our assumptions about what good health means across cultures.
Live longer. That's not a value we totally resonate with. The idea that I'm going to live longer, struggling for longer, is not necessarily a good selling point. But talking about the ability to transfer the legacy of your life so that my next generations to come will do better than me, because that resonates with us.
These aren't just conversations, they're real catalysts for changing a system that desperately needs it. Racial and ethnic minorities often receive lower quality healthcare than white patients, even when factors like insurance and income are equal. Whether you're a doctor, nurse, family member of a patient, or simply someone passionate about health equity, this podcast is for you. We'll explore how we can build a system where every individual feels seen, heard, and valued, no matter what their background is. Go to www.healthcareforhumans.org, where you'll find links to listen on all your favorite podcast platforms. New episodes drop every 2 weeks. See you soon.